The Premier.
Thank you very much, Mr. Speaker, and it's with great pleasure that I rise during National Nursing Week to acknowledge the immense contribution that nurses make to the health of the people of Ontario and to thank them for this contribution. And I want to begin by thanking the nurses in this legislature. Yes. The member for Cambridge, yes. The member for Scarborough Agincourt, the member for Haliburton, Kawartha Lakes Rock, the member for Welland. Now those are the nurses that I know. If they're beg your pardon? And Madeleine Mayor, and the member for Ottawa Vanier. That's right. I want to thank all of them, but I want to thank all of their colleagues around the province. And to the doctors in the legislature, I want to say I know that they know the importance of nurses. The commitment of nurses to patient care is commendable and it's inspiring. Le dévouement des infirmières et les infirmiers envers le soin aux patients est louable et une source d'inspiration. As our government works to transform our healthcare system into one that is patient-centered and sustainable, nurses play a valuable role in helping us to provide that coordinated quality care. I just realized the member for Nickel Belt, is she not in it? She's not in it. She's a physio. Okay, sorry. I do not want to miss anyone. Still great. So that valuable role that nurses play in helping us to provide that coordinated quality care is so central to our healthcare system, Mr. Speaker. Since 2003, we've expanded the total number of nurses employed in Ontario by over 24,000, and that includes 3,500 more in 2014. Remarkable. We have invested to support nurses at every stage in their career, improving access to continuing education and professional development, and enhancing recruitment and retention. Just today, Mr. Speaker, the Minister of Health and Long-Term Care launched our new plan for home and community care, which will improve and expand service, including 80,000 additional nursing hours to help make it possible for patients with complex care needs to receive care in their homes and in their communities. Wonderful. In addition to recognizing the important role that nurses play, our new plan to improve home and community care is good for patients and their caregivers and will help us ensure that people get care when and where they need it. Mr. Speaker, I look forward to continuing to work with nurses on the critical transformation of our healthcare system. Monsieur le Président, je me réjouis à la perspective de continuer de travailler avec le personnel infirmier sur cette transformation essentielle de notre réseau de soins de santé. We value them as partners in the healthcare delivery, Mr. Speaker, in this province, and we appreciate everything that they do every day for patients across the province. Thank you to the nurses across Ontario for all that they do. Merci.